The following program is a Town of Colonie television production of the William K. Sanford Town Library. Well, good morning, good afternoon, good evening, whatever time you're watching this program. My name is Tom Scarff from the Albany County Department for Aging, and you are watching Young at Heart right here on the Colonie Access television station. And we are here, and I say good morning, afternoon, or evening because we never know what time it's going to show, because the good people here in the town of Colonie have it on at different times on your local public access channel on Time Warner Cable. And I want to thank you for being with us this morning. This is a program that we've kind of reinvigorated. I was very happy to have hosted and produced this program, Young at Heart, back in the 1970s on WRGB Channel 6. And we've brought this back some 30, 40 years later. And we're going to talk about all things aging in Albany County, and things that we might not really consider to be problematic within the aging community that really are. And today we're going to talk about something that is coming to the forefront because basically, or especially because of a new casino that is coming up in Schenectady, and the Rivers Casino. And we're going to talk about the problem of compulsive gambling in the senior community. My guests today are Carla Clayton, Program Director, and William Hill, Primary Counselor, and William Hill, who's the Program Director at the Center for Problem Gambling on Warren Street in Albany. And I was kind of not really surprised because I do have a history of knowing about problem gambling, but I was kind of surprised to find out that it really is a problem. Thank you for being with us.
Thank you.
Today's program.
Thank you.
We're happy to be here.
Thank you. Can you tell me what are some of the warning signs? What do you look for when you look for the possibility of a person having a problem with gambling?
Well, are we talking about the senior population?
Yeah, let's talk about the senior population.
Well, lack of funds for food, lack of funds for general maintenance of things, change in affect, meaning mood and so forth, without any explanation.
Like going depression?
Depression, anxiety. Many seniors start to detach from their support systems, children, and so forth.
So there are some warning signs.
There are.
What do you look for when you diagnose somebody with compulsive gambling? Is there a survey that you take with the person? How do you diagnose somebody?
We use the diagnostic criteria from the Diagnostic Statistical Manual 5,
DSM,
which has changed compulsive gambling to the term gambling disorder, which puts it in the category of an addiction.
Okay.
Gambling disorder is a brain disorder, same as substance abuse, etc. And we start to look for, does the person gamble more? When he doesn't gamble, does he have significant depression and so forth? Are there disturbances in recreation, social patterns of behavior? Do they start to borrow money from other people? Do they start to exaggerate or lie about where their funds are going?
So it's unlike a lot of other addictions where there's a physiological outward physiological showing of the addiction. For instance, the DTs, although I do understand that people that are compulsive gamblers can actually have the physical.
Significant withdrawal, yeah, which was that's one of the most surprising things, I think, is that you're not talking about a substance. So you wouldn't expect a physiological response to the stopping of the activity, but there absolutely is a significant withdrawal. And what Bill and I found in working directly with gamblers was that not only is there a withdrawal, but the post-acute withdrawal that substance abuse folks talk about or pause it lasts much longer with gamblers, and it's much more severe. Depression, irritability, insomnia, poor appetite, all of these things impact the gambler immediately, and because they persist past where someone, say with substance use dependence, alcohol, will have a significant period of withdrawal, and that's often medically managed, and that withdrawal will continue for a period of time, but the physical aspects of it are over, the worst of it, within maybe 10 days.
Now, you don't advocate no gambling for anybody at all,
Oh, no.
right? Because
We don't have a problem with gambling at all. Many people gamble. Many of my friends gamble socially. It's not the gambling per se. It's the people who are vulnerable to developing a gambling disorder. And that can be anyone. It can be you. It can be me. There's a lot of studies that suggest that maybe family history is significant, but I think the seniors, Bill and I have seen this since we started. Bill hired me, and I left a 24-year career that meant a lot to me because I wanted to work for Bill and I wanted to work with the gamblers. When I started to meet with the seniors, it became a passion and a mission because they're very vulnerable. And it isn't something that people necessarily link with anyone. A gambling disorder is difficult for people to conceptualize, period, but most especially with seniors. And it's a significant problem.
So how long has this become an area that you would think about? Because, I mean, compulsive gambling's been around for quite a while.
Yeah.
But
yeah.
Is it new now to be looking at the senior population as an area that would need special treatment?
We at the Center for Problem Gambling, we've made looking at seniors a top initiative because they are a very underserved population. It has been, gambling disorder is so normalized in the population in general. Excuse me, and it appears to be more a part of seniors' social protocol. They, in homes, they go to casinos, etc. And one of the things that we found out with our little sort of trip out to senior citizens, well, we're finding a big problem.
Yeah.
So we have put it one of the top things on our list that we're going to address.
Now, the State Office of Substance Abuse Services now has a specific credential for gambling treatment. And what would that be? That's a Case-Ag-G,
Yes.
I believe? And what's the difference between the modalities that you use for treating gamblers versus treating somebody with a cocaine addiction or an alcohol addiction? Are there any real differences?
That's something that we're learning. We're learning how to treat gamblers. And our main emphasis with people with gambling disorder is engagement, to keep them engaged. At the Center for Problem Gambling, we have a philosophy. If you gamble today, you still come in. If you gamble when you leave here, you still come in. What we have found out, the longer that we can keep individuals engaged in treatment, the better the outcome.
Well, but now when you're dealing with seniors, the old adage, you can't teach an old dog new tricks.
Yeah.
Can you?
Yes.
Yes.
Okay.
Yes.
And how do you find that? I mean,
Well, it may be a little more difficult. Well, let's step back a little bit.
Okay.
The platforms for treatment are abstinence-based or harm reduction. And if we can't get an individual to stop gambling, which is the safest way, then we say, if you're going to gamble, how about we try to make it safer for you? Okay, to try to better manage money, better manage your medical situation, better manage your life.
Bill, is it like a fix that a person gets when he places a bet, or he has I mean, it seems to me like it's almost gamblers chase everything. You know, it's the action. from what I understand. And I'm wondering if it's like a fix, if it's like a drug addict that needs to get that one shot. And what you're saying is you can have the shot, but gamble with your head, not over it.
Right.
I don't know if that's what you're talking about, or when you say control.
Well, if you're going to gamble, let's try to do it in a safer way.
Yeah.
That's exactly what I'm saying.
Yeah, I think the harm reduction model, people get very confused about what that means. When you adopt a harm reduction model on a clinical basis, that does not mean that you're not working towards abstinence. It just means that, as Bill said, the most important thing with any of the addicted population, but most especially with gamblers, is you have to keep them engaged. And if you immediately adopt a hard line, particularly with seniors who have worked their whole life, have developed their set of values, and you need to treat them with respect and with dignity, and you don't tell them what to do. That's disrespectful. So you engage them, and if they say, I don't want to stop gambling, but I'm willing to take a look at ways that I could maybe gamble more safely, we can do that. We can reduce the harm associated with gambling, particularly financial, especially in terms of casinos. Seniors are extremely vulnerable in casinos.
Yeah.
Casinos are set up to make an elderly person feel safe. They're handicap accessible. An older woman can go to a casino alone and feel okay, feel safe. And yet some of the people in the casinos that are problem gamblers, that have gambling disorders, are not well people. And they are predatory. And so these are some of the things that you can look at with the person early on when they enter treatment, instead of immediately adopting a stance where they've got to choose either or, and you're going to lose them right there.
Why would somebody come to you? At what point in their life do they say, I need help? Or is it after are a lot of your clients mandated into treatment?
No, not at this point.
So how do you get somebody? I mean, is it because
The bottom has fell out.
So family would say,
Sometimes family says either get treatment for this or I'm leaving.
Yeah.
Or financially, the bottom has fell out. Sometimes there are some legal issues involved because there is a lot of stealing from employers.
Bounce checks, things like that.
Yeah.
Sure, and sometimes it will be a legal situation.
Yeah.
We have had many people who have worked all their lives for big companies, city government, state government, and raised families. And as the gambling addiction progresses, because it is progressive, similar to any substance use disorder, they do find themselves embezzling and ending up in prison. And in terms of the elderly, we found in a couple of cases, the adult children of the elderly person became aware. Things had changed, and they weren't sure what was wrong, but they knew something was. And when they started to look at the checkbook and the financials, they realized that things didn't add up. Mm-hmm. And then they call Bill, and Bill says, come in. And in these cases, the adult children come in with mom or dad, and we talk with them as a family first.
Do insurance companies recognize this as a disease? In other words, can you get insurance reimbursement for treatment? No. Do you think that'll change now that casinos are cropping up all over the place? And
I hope so, because that's a barrier to treatment for a lot of people.
Yeah. I would imagine if you're losing money constantly and you don't have enough money to pay your mortgage,
that's right.
You're going to be reluctant to go, and it's embarrassing for an older person to say, I don't have any money to pay for this.
Very embarrassing.
Very, very shameful.
So how do you work that? Do you work it on a sliding scale?
Well, yes, we do.
Okay.
But our program is a little different. We are what is called a deficit-funded program. That means that we will treat anybody at any time, regardless of funds.
Okay.
Okay.
Are there inpatient programs for gamblers?
Yes, there's a program at St. Lawrence, has an inpatient program.
And
the difference between that program and our program, we treat specifically gamblers. Mm-hmm. That's all we do.
And we are the only ones.
The only one in the state to do that. At St. Lawrence, it's a mixture of substance abuse and gambling.
Oh, okay.
Okay.
Okay. And is that at that St. Lawrence
St. Lawrence Addiction Treatment
ATC.
Center.
in Ogdensburg?
Yes.
Okay. Yeah. So, all right. So somebody comes to you, and you go through an evaluation, I would imagine, first.
Yes.
And at the point that you determine that the person has a problem, what's the next step?
Immediate engagement.
Okay.
It needs to be very, very quick. Bill makes that point with all of the staff, and we implement it. We have next day appointments. If you were to call tonight, you will be seen the next day.
Okay.
And we will do the paperwork that's necessary to admit the person into the program to be in compliance with OASAS. And then we will do an assessment, and then we will do a comprehensive evaluation. But as soon as the person is admitted, they begin services. They can come to a therapy group that evening. They will see a counselor that day, and they can begin program services that evening.
Is cross addiction a big part of this? Are most of are a number of your compulsive gamblers also either alcoholic or substance abuse addicted?
Many have had substance-related use disorder problems. About 30-35% of persons that we do see have had some substance-related use disorder problems.
Is this a family type of a disease, such as alcoholism or substance abuse, where
Yes
the
and no.
entire family gets sick? Okay.
Yes and no. If I'm in a family environment where everyone gambles and it's been normalized, then there's a family origin.
Okay.
Okay. Some people have a neurological origin. Okay. And as I said initially, gambling disorder is a brain disorder. Some people are born with low levels of dopamine in their body, and so they're very vulnerable to any type of addiction to bring that dopamine level up. So there's a genetic link, there's a family environmental link, there may be a family environmental link, and then there's a lifestyle link too.
Is there a medicine that can be taken?
Well, the research is really in its infancy. One of the things that when I started working at the center, Bill does a lot of research, and he passes it on to his staff so that we stay as cutting edge as we can. And I've looked on my own, and quite honestly, Bill and I have found that there is very little research coming out of the United States. There's more research coming out of Canada, Australia. So you have to be diligent. You have to really dig for it. It's very, very new. So some studies suggest that some of the medications that are helpful, for example, for alcohol, naltrexone is one. So there are some studies that suggest that may be helpful for gamblers. There's studies that suggest that some of the antidepressants that were used starting in the 90s to help the addicted and those struggling with alcohol. But there isn't anything definitive yet.
As somebody who's 65, senior citizen, comes to you and has a problem, is that a new problem for this person, or do you find that person has a long history of gambling?
The gamblers that we've treated all have long histories. Okay, gambling disorder, because of it being gambling disorder being normalized, it has an opportunity to progress for a very long time. Many people who come to our program have gambling histories of 10, 15
More
years.
and more.
Yeah. So it has progressed to a point where it's out of control.
Which I think is why the devastation happens, is because it stays underground for a very long time. Folks that have gambling disorders look just like you and I. And to their family, it would appear for a long time that there's nothing wrong. And so by the time the gambler is in great pain, the money is gone, the home may be gone, there may be second mortgages taken out, the home may be close to foreclosure when the spouse thinks the house is paid for, IRAs are drained, there's a great deal of damage done. And with this, the only exception being, I guess I just have to say that I have seen real telescoping with women. It progresses very much more rapidly with women.
It does.
Yeah.
Yes, and women typically will hit a life stage change where they may lose a spouse to death or divorce. Their children may be grown and independent and gone, maybe moved across the country and started their own family. And so the roles that they had, they may have retired, and suddenly there's an emptiness. And gambling seems a very healthy, safe way to fill that time. They may go with friends. They may start with bingo. They may start with raffles, and they may progress to casinos. But it really does progress much more rapidly with women. And the interesting thing to me, and the hopeful thing, I guess, because I work with a lot of the women that are gambling and with the families, is that women seek treatment quicker than men. Perhaps because they crash faster. So that's a hopeful sign.
Or what about a senior comes to you and says, my wife died and blah, 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 and this is all I really have to do is to gamble.
Yeah.
I go to OTB every morning, and we have coffee, and then we bet afterwards.
Sure.
Unfortunately, a lot of times they're spending their rent, or they're spending their mortgage, or they don't have any money to eat. But what's the answer to that?
The answer to that is come in. That's the answer. Come in to let us help you. Okay? And we'll figure out an appropriate treatment plan for that person.
We have established a strong community atmosphere in the center. We've had events. We had a wonderful event over the weekend where people in long-term recovery from gambling disorder came and spoke, gave of their time, and shared their story. And one of the gentlemen that spoke was 87 years old, and he had 10 years of gamble-free time. And the environment was uplifting. It was inspirational. People were moved because the center, for now, is the only place there is. So it's become a hub. We have GA meetings there. People can come in on their off time and have coffee before the meeting or after. The people who are in therapy groups together socialize outside of the center. So we help them develop other interests, other hobbies. And they need that after years and years of looking at gambling as being the only thing that they have to look forward to. We can help them develop other interests, starting small.
How important are the self-help groups to the compulsive gambler?
Very important.
Very important.
Very, very important. Number one, we have to, one of the aims in our treatment program is to reacclimate people with gambling disorder to socializing. See, gambling is a very solo activity. I don't want you along. They separate from family, friends, and so forth. And it disturbs a gambler's what we call object relations, where he's not relating to people anymore, he's relating to machines. Okay, so we have to sort of turn that around. Self-help meetings or mutual aid meetings start that process. We try to develop a community in the center of support.
Yes.
And we try to widen that to GA meetings or any type of meetings. We're not solely GA. There are other mutual aid meetings around. We just want them to get out, get involved with other people, more socialization, volunteering, and so forth. Very, very, very important.
Now, what do you mean by a mutual aid meeting?
Mutual aid meeting is the same as self-help meeting.
Okay. So it could be an AA meeting or an NA meeting?
Or it could be a smart recovery, or it can be a spirituality meeting. Okay, we support multiple or many pathways to recovery.
One thing that I was thinking about the other day, actually, because I saw a commercial, is the $1 in a Dream that the state promotes. And it's, a $1 in a Dream can turn out to be a nightmare to a lot of people, I would imagine. Because, with alcoholism, you can't drink and drive, it's illegal. Drugs, you can't, you're not supposed to use illegal drugs because they're illegal. But gambling is promoted throughout the state with both lottery and now casinos and with horse racing. How do you deal with that? I mean, if you're sitting at home and you're addicted to, and I would imagine some people are addicted to scratch-offs and things like that.
Sure.
But then you see the $1 in a Dream and you see people in limousines and everything else. Why are they allowed to promote like that?
Well, you have to ask the state that question. But what we try to do is work on things like urge management. Okay. See, what has to be understood with the substance abuse disorders, the triggers are much more specific. We talk about people, places, and things. With gamblers, and gamblers have told me this, it's like a bee going off in my head all the time. That's how disruptive the urges are. Every 13 seconds.
Right, I can imagine.
With people with substance-related disorders, like I say, the triggers are much more specific, places, people, etc. But with gamblers, it's called life.
Yeah.
Can I make this red light? Who's going to wait on me first? It's very disruptive. So we focus in on urge management. You know, what to do when you do get those urges. You're smiling.
No, well, because I guess when you think about it, life is a gamble.
Yeah.
You know? I mean,
Well, that's what it becomes. But let me go back to a point, because I think the point has to be made. The progression of the disorder, how for so long it goes on without being addressed, which I think leads to the high suicide rate.
right.
The suicide rate in gambling disorder is 5 times higher than any addictive disorder.
Well, I can also say this because I know it for a fact. We will have already had the Summit on Aging Services in Albany County when this shows.
Yes.
But it is actually going to be 2 days after we're taping this, and we do have somebody coming to speak about suicide among seniors.
Okay.
And 33% of the suicides in Albany County were senior citizens.
Yeah.
And the highest rate of suicide is among those people that are 85 and over.
It is devastating.
And it is devastating.
Yes.
And I can imagine that when you work your whole life to build a nest egg,
Yes.
and then you blow it on something that you get no return for at all, other than that whatever it is that the dopamine that you're talking about, then it would be, what do you have to look forward to? How do you talk to somebody about that? What is there after that?
Well, you're absolutely right. I think that, particularly with the seniors, the shame and the guilt is tremendous. But when they come into the center, the first thing they're met with is an atmosphere of acceptance and tolerance and kindness, and most of all, respect. We respect them. We treat them with respect. And as they meet peers that are in similar situations, they see that life can and does change. Regardless of age, life can and does change. And so people have to have hope, right? With gambling disorder, when Bill said the triggers are life, even taking that to a different level, gamblers can, by the time the disease has progressed and it's a brain disease, they're coming into the parking lot. We have people tell us this, and they're looking at license plates for numbers. Those are the numbers I'm going to play tonight. So the brain disease is powerful, but the atmosphere at the center, I think, is the most important. Give people a sense of community and hope first. And then each individual is different, and each treatment plan is different. But there are a tremendous amount of things to look forward to. But you have to get the person through that early stage where it's difficult. It really, scientifically, that brain disease is very difficult the first year, very difficult. And that's why Bill established a continuing care program where they can stay with us as long as they want. That community at the Center for Problem Gambling is there as long as they need it.
Well, I want to thank you both for being with us
Well,
today.
thank you.
Thank you.
Carla
so
Clayton,
much.
who is a primary counselor at the Center for Problem Gambling. William Hill, who is a program director at the Center for Problem Gambling. If you take anything out of today's program, please take the fact that there is hope, that there is a place that you can go to, a safe haven, and not just a haven, but also a place where you can progress and be happy again.
Yes.
Because it is a depressing disease. If there is nothing that you can do, but there is something you can do. The Center for Problem Gambling is on Warren Street in Albany. It's been around for a long time, and it is the only gambling-specific treatment center in the state. So I want to thank you both,
Thank you.
Thank you so
and
much.
we will see you again next time on Young at Heart.